Culturally competent nursing care for Middle Eastern Americans. Middle Easterners are people of ancestry from the Middle East and many other parts of the Arabic-speaking world. They include various ethnicities and nationalities such as Arab, Syrian, Lebanese, Egyptian, Palestinian, Kurdish, Assyrian, Chaldean, and more. When caring for a Middle Eastern patient, ask if he or she has cultural or religious considerations to healthcare. Many Middle Eastern Americans speak English, but may speak Arabic as their primary language. Other languages spoken throughout the Middle East include Turkish, Coptic, Urdu, and Farsi. Use a certified interpreter to communicate with patients who do not know English, or if English is not their primary language. The predominant religion of the Middle Eastern American community is Islam. However, there are a significant number of people in the Middle East that also practice Eastern Orthodox Christianity, Zoroastrianism, and small religious groups like the Druze. Most Middle Eastern Americans follow the holistic health model of understanding health and illness. According to the holistic health model, an individual is composed of the individual's body, mind, social life, and spiritual life, and illness is the result of an imbalance of the patient's physical, mental, social, and spiritual needs. However, there may be some Middle Eastern American patients that follow the magico-religious health model, which claims that health and illness are controlled by supernatural forces, such as the will of God or magic. There are several culture-bound syndromes that can be observed in the mental health of the Middle Eastern American community. An example includes jinn possession. A jinn, known better in the Western world as a genie, is an invisible spiritual being made from smokeless fire that can perform magic and can possess humans. Signs of possession include psychological distress and intermediate, involuntary, and abnormal body movements. Treatment involves an exorcism by an imam. Key elements of Middle Eastern cultures include having an extended family with strong kinship bonds, hospitality and courtesy towards friends and strangers, strong religious/spiritual orientation, and strict gender roles, with most families being patriarchal in structure. Diseases and disorders common among Middle Easterners include cardiovascular disease, lower respiratory infections, preterm birth complications, hypertension, and depression. Avoid using Middle Eastern stereotypes, such as all people from the Middle East are either Arab or Muslim, and that all Middle Eastern people support terrorism.